Hello, everyone. Thank you for joining us for this live conversation celebrating the second birthday of ChristianaCare's Center for Women's and Children's Health. It's hard to believe it's already been 2 years since opening this state-of-the-art space, but there's so much we continue to celebrate. Today, we've brought back Dr. David Paul, Chair of the Department of Pediatrics, Dr. Matt Hoffman, Chair of OBGYN, to discuss all of the features of the Center for Women's and Children's Health. Dr. Paul, Dr. Hoffman, I feel like we should have cake today.
Sounds good.
Thank you.
So just a quick reminder for anyone watching, if you have any questions for Dr. Paul or Dr. Hoffman about this building or any of our services, please leave those in the comments below. Also, we'll share a fun fact at the end. How many babies have been born in the past year? So since the first anniversary to now, how many babies have been born? Think high numbers. Put your guess in the chat and we will let you know what the answer is at the end of this conversation. So let's start from the beginning. Dr. Paul, not everyone may be aware of the building if they're just newly pregnant or just new to the area. So how would you describe the Center for Women's and Children's Health?
Thank you, Megan. First of all, thanks for having this event. We're really excited to be celebrating the second anniversary. The Center for Women and Children's Health is a 7-story tower on our campus. The top 2 floors, the 7th floor and the 6th floor, are our postpartum areas. So single family rooms, really bright, beds for dads to stay, showers, much bigger rooms than we had in our old hospital. The 5th floor is shell space. We hope to get back to you about future growth on that. The 4th floor and the 3rd floor are hold our neonatal intensive care unit. They are single family room neonatal intensive care unit, meaning every baby is in the same room with their parents and separate rooms from the other babies. Our old NICU was a bay design, so multiple babies really in the same room. Each room has, again, a bathroom, so parents don't have to leave the room. They can stay overnight. We welcome them staying overnight. There are separate, some rooms specifically for twins, even bigger rooms if we happen to have triplets and need to care for multiple births. There is a Ronald McDonald room for families with some kitchen space. Our 2nd floor is a continuation of labor and delivery. We have some new labor and delivery rooms. We still use our older rooms, which have all been updated as well. There's a high risk area on the 2nd floor. And our 1st floor is the lobby space with OB triage or OB emergency room, some new retail space that I think we'll hear a little bit more about. Again, it's been a great space for families to spend time after birth with their baby and with their loved ones.
Being one of those families, I can share that this building is amazing for new moms, but there have already been new additions since I had my son in November, which seems amazing. Dr. Hoffman, tell us about what's new here in the Center for Women and Children's Health.
So we've been super happy to open up the building again. I think folks are aware that we've been obviously living through very COVID restrictions. Those restrictions have now been limited, and as part of that, we've opened up a lot of our public space, which we hadn't before. So a couple things. We know being a parent is complex, that you forget things, leave things, need things. So we've now opened up a gift shop that is exactly oriented towards families. So those things that you may have missed in packing or need or want to send is now available right in the building. Similarly, we have opened up a cafe actually literally today to let families get a quick bite to eat. So recognizing that folks get hungry, labor can be a process. We need to feed and support our families. We've also had that available. And then we also have some public lecture space that we hope to continue to utilize. We've had a number of online courses on eating for pregnancy, other issues in terms of pregnancy, and our hope is to start to open those up as hybrid, knowing that many people find that more convenient if they want to stay home, but also join us from that perspective. Also, just to echo a little later on this summer, we're going to be opening up what we're calling the OBGYN Access Center. So finding a provider can be challenging, trying to get care immediately, people wanting to have questions and access. So as part of our OB emergency room, we'll be segmenting a part of that to provide care within 48 hours to folks who need issues, and trying to also use atypical hours, knowing that Monday 8 through 5 doesn't work for everybody. So we're looking forward to that as well.
Fantastic. And Dr. Paul, we had a big announcement just this morning. So the cafe opened today. We also had another announcement. The up and coming Pediatric Care Center will be opening in a few months. Talk about what that will be like for the community.
We are really excited about the Pediatric Center. We also refer to it as a 24/7 Pediatric Care Center because it's going to be open 24/7 as described by the name. And it's really going to provide after hours care, urgent care, emergency care for pediatric patients. And right now we see a tremendous volume of pediatric patients within the ChristianaCare system, but this is going to provide a pediatric specific space. It's going to be staffed by pediatricians who are trained in hospital medicine, pediatric urgent care, and even emergency medicine. So it's going to be really high level of care. We're going to see all patients except those at the beginning who are coming in by ambulance. They're still going to go to the main emergency room for the time being. We also recognize that pediatric behavioral health and mental health is a growing crisis in this country. At present, we are just seeing a really high volume of patients who need behavioral health needs. So we have designed the Pediatric Center, the 24/7 Pediatric Center. With that in mind, we recognize that we'll be caring for children who have behavioral health needs. And we're going to do our best to serve all of the needs of the pediatric community, again, in a very pediatric, centric and family center way.
Absolutely. All new and exciting things. But Dr. Hoffman, let's also talk about what we've done over the first 2 years. This was an incredible building. It's only getting better. Talk about what a new mom's experience will be like today if they come into the Center for Women and Children's Health.
Yeah, no, so we've really worked hard to try to make it a seamless experience. And just to say, it's not just about the building, it's about the people in the process. So we have worked on that as well. For those of you who are looking for a virtual representation, we just posted a virtual tour of our new facility. But recognizing we're trying to build it around a family and a concept. So I'll just take a journey of a high-risk mom. So our high-risk unit is extremely large rooms, recognizing that many of these women may be with us for a period of time. They have family members who want to visit, and they may be there for a prolonged time. So we allow them to customize the room while they're there. We've had folks bring in everything from potted plants to favored pictures. In addition to that, we have a garden that's adjoining there, so people can go out, get sunshine, enjoy flowers, etc. So having an opportunity to have less of a hospital experience in a hospital is important. As Dr. Paul had mentioned, we've updated all of our labor and delivery rooms to include showers. We've also instituted mobile monitoring so our moms can get up and around if they choose to not have an epidural from that perspective. And then on top of it, we are now in our postpartum area, have large single family rooms which accommodate families. I'll say one thing that we're excited about is we are introducing a co-project with Amazon to embed an echo where you can now use your voice to ask for common things rather than a call bell. So that's a pilot we'll be venturing into later on this summer, recognizing that we need to invest in technology. I will say we've also done a lot, and we'll have more in terms of making our services easier to access online. Self-appointment scheduling will be coming later on this summer, and also what I will call pathways. So not just your doctor visit, but here's sort of the pre-education and then the follow-up virtually, as well as making things like monitoring your diabetes, high blood pressure, other things that commonly complicate pregnancy will be forthcoming.
So even more exciting things on top of what we just talked about. And Dr. Paul, let's talk about the NICU. We have an incredible NICU. We have amazing couplet care. As a couplet care mom myself, I cannot speak highly enough about it, but tell our audience what that is and how it helps new families.
Sure. That is one of the really unique aspects of our building and unique programs that we have here, in that there are very few places throughout the country where you can get couplet care. And people may not even realize when they're part of it how different it is. But in most neonatal intensive care units across the country, if your baby needs to come to the NICU, you're going to be cared for on a regular postpartum floor, and it's going to be quite distant from the NICU. You're going to have to come up and down the hallway or up and down the elevator to get to see your baby. And that may be really difficult after a cesarean section. And, or even after a vaginal delivery. And so what couple of care means is you are a patient in the NICU in a suite with your baby. So you really don't have to leave. You can see your baby. You can be there to breastfeed when your baby's ready to breastfeed. You can talk to the nurses all the time. Your support person can stay in the room with you. And it just essentially means not being separated from your baby. That model of care has been shown to decrease some of the stress of being in the NICU in some recent papers. So we know it's really helpful for families. And when I said people don't even realize they're part of it, I mean, they now, a mom comes and she's admitted to couplet care, they think that's just the way it is. But again, if you're at a different hospital, you're likely to be separated from your baby. There's really, there's no other hospitals in the region that offer this type of care. So we're really proud to present it. And if I could go back to something that Dr. Hoffman said, he talked about visitation. We are open for full visitation now. I just want to thank the parents who've been here during the pandemic. There have been times where we've had to limit visitation throughout the building. That's not what we wanted to do. Nobody expected for us to have a pandemic when we opened up the building, and parents have been really understanding for the most part. We all want the staff to be safe and the babies to be safe. And so during the times we had to limit visitation, I know it was a hardship on many families. And so thank you to everybody who may be listening for working through that with us.
And I just have to share, as someone who had a baby at the height of the last surge and someone who unexpectedly became a couplet care mom, your nurses and your doctors are everything to new moms. And I'm sure I speak to for a lot of people watching that we thank you as well and your teams for making that experience less stressful on us. You mentioned that papers are showing that couplet care limits stress. I can tell you firsthand that couplet care helps with stress. So certainly happy to be able to spread that and tell everyone else about that as well, because many people watching probably don't expect to necessarily end up in couplet care or need NICU care, but your teams make it as an enjoyable experience, I guess, as possible, which is amazing. So last question is for both of you. The purpose of the Center for Women and Children's Health has always been to provide family-centered care. Obviously, we continue to do that. Talk about, your team specifically, the OBGYN teams, the nurses, the pediatricians, the hospitalists, and how they continue to show those values and behaviors here at ChristianaCare.
Dr. Hoffman, do you want to go first?
Defer to you, Dr. Paul. I'll let you go first.
Well, those values and behaviors, Megan, I think we live that every day, and it's in our mission statement, and serving our neighbors as expert valued caring partners, and that's, I think, what we come to work every day wanting to do is serve with excellence and love. It is kind of our North Star. We feel like we provide great care, and the times when we don't, when we hear from patients, we want to learn from that, and so it's always a learning experience. We are getting better every day, and it's something that the care we provide is something that we're really, really proud of here.
So I'll just echo that a little bit. I think we are recognizing that we need to continue to support families, learn from families, listen to families, think about atypical ways to care for people. Not everybody comes to this journey in the same way. So we're very open to suggestions, thoughts folks have, and we take our feedback very seriously. We try to talk to our families when there's opportunities, but also recognizing that we have a commitment to the community. How can we improve care? How can we be with them, whether it be through more virtual care, through more education about health, and thinking about families over the lifetime. So I know we've talked a lot about particularly pregnancy, but your focus has also been on women's health care. So we've opened new sites. We also have added more subspecialists, knowing that those unique services for urogynecology care, also minimally invasive surgical care, are really unique in the community. We need to meet the needs and the progressive needs of the community in that regard.
Fantastic. Thank you both so much for sharing all of that incredible information today. If you're watching, you've made it to the end of this interview. And if you're wondering how many babies have been born in the last year, the answer is 6,352. So very impressive. If you got that right, please tell us in the comments if you did. But obviously there are so many babies, so many families being taken care of here at the Center for Women's and Children's Health. And if you'd like more information, please see the links in the comments below. And if you have any questions, please continue to submit them and we can always answer them in the comments after this live wraps. Thank you all so much and have a great day.
Thank you, Megan.
Take care. Bye-bye.